everyone, I'm Agatha Mamaril from BSN 1B, and I'm here to show you how to properly take your vital signs. For the assessment, assess any clinical signs and symptoms affecting the vital signs, assess the site most appropriate for measurements, assess factors that may alter the vital sign, assess skin and mucous membrane color, position appropriate for the procedure, activity tolerance, and assess if there is chest pain, dyspnea, signs and symptoms of hypertension or hypotension, factors affecting blood pressure, and determine the policies and procedures for the facility, determine the client's record for medication that may increase or decrease the vital sign. For the planning, assemble equipments and supplies such as thermometer for temperature, sphygmomanometer for blood pressure, watch with second-hand indicator to check for pulse and respiration, and also stethoscope. Good day, ma'am. I'm Agatha Mamaril from NUST, and I will be your student nurse for today. May I ask what is your name, ma'am?
Maria Cristal Coewar,
When is your birthday?
October 24, 2003.
And your age, ma'am?
13.
Alright, ma'am. So for today, I will get your vital signs. Is it okay, ma'am, if I get your vital signs?
Ano po yung gagawin?
The purpose of vital signs po is to get your baseline data and to know if there are problems regarding your health or if there are no problems at all. The vital signs po consists of 4 elements, which are temperature, pulse rate, respiratory rate, and blood pressure. We also consider pain as the 5th vital sign. So, may I ask, ma'am, if you're experiencing any pain? From 0 for having no pain and 10 for having severe pain.
0 po.
Okay, it's good to know, ma'am. First, I will get your temperature. Getting the temperature, first clean the thermometer from tip to body. Place the thermometer to the appropriate site. And wait for an appropriate amount of time. Electronic and tympanic thermometer will indicate that the reading is complete through a light or through a tone. And then remove the thermometer and discard the cover or wipe with a tissue or cotton from body to tip. Read the temperature. If the temperature is obviously too high, too low, or consistent with the client's condition, recheck it with a thermometer known to be functioning properly. Ma'am, I will get your pulse rate. In getting the pulse rate, select the pulse point. Palpate and count the pulse, and then place 2 or 3 middle fingertips lightly and squarely over the pulsing point. If taking the client's pulse for the first time when obtaining the baseline data, or if the pulse is irregular, count for a full minute. Assess rhythm and volume. After getting the pulse rate, observe and count the respiratory rate. Hold your position as if you are still counting the pulse rate if you anticipate the client's awareness to the respiratory assessment. And then observe the client's chest movement while supposedly taking the radial pulse. Count the respiratory rate for 60 seconds. An inhalation and exhalation is count as one respiration. Observe the depth, rhythm, and character of respiration. Expose the upper arm. Wrap the deflated cuff evenly around the upper arm, and then locate the brachial artery. Apply the center of the bladder directly over the artery. For an adult, place the lower border of the cuff approximately 1 inch above the antecubital space. If this is the client's initial examination, perform a preliminary palpatory determination of systolic pressure. Palpate the brachial artery with the fingertips. Close the valve on the pump by turning the knob clockwise. Pump up the cuff until you no longer feel the brachial pulse. Position the stethoscope appropriately. Cleanse the earpiece with alcohol or recommended disinfectant. Insert the ear attachment of the stethoscope in your ears so that they tilt slightly forward. Auscultate the client's blood pressure. Pump up the cuff until the sphygmomanometer reads 30 mm mercury above the point where the brachial pulse disappeared. Release the valve on the cuff carefully so that the pressure decreases at the rate of 2 to 3 mm mercury per second. As the pressure falls, identify the manometer reading. Deflate the cuff rapidly and completely. Alright, ma'am. Thank you, ma'am. If there are any concerns, please don't hesitate to ask me. Have a good day, ma'am. For the evaluation and documentation, document all data in the vital signs record sheet, report abnormal results to the primary care provider, and then document the procedure in the client's record. That's it for today. Again, I'm Agatha Mamaril, and see you in my next video.